What is acute stress disorder, and how does it affect your brain? Imagine experiencing a sudden, overwhelming event that leaves you feeling shaken and on edge. That's what acute stress disorder is all about. It usually happens within 3 days to a month after a traumatic event like a natural disaster, serious accident, assault, or the sudden loss of someone close. It's a way your mind and body react to intense stress. People with ASD often have intrusive memories or flashbacks, feel anxious or numb, avoid reminders of the trauma, and may struggle with sleep or concentration. These reactions are your brain's way of trying to process and protect you from the overwhelming experience. From a neurological point of view, ASD involves a surge in activity in the amygdala, which is the part of the brain that processes fear and emotional memories. When the amygdala is highly active, it makes you hyperalert and emotionally reactive. At the same time, the prefrontal cortex, which helps you regulate emotions and make decisions, becomes less effective. This imbalance makes it harder to control fear and emotional responses. The hippocampus, which helps form and organize memories, can also be affected. This can cause difficulties in recalling specific details of the traumatic event or lead to fragmented memories, which are common in ASD. Dissociative symptoms, like feeling detached from yourself or the world, are also linked to disruptions in brain networks that integrate sensory information and emotions. These symptoms act as a protective mechanism, helping you cope with overwhelming distress temporarily. However, they can interfere with daily functioning and make it harder to process what happened. Understanding how ASD impacts the brain is important because it shows how trauma affects your mental and physical health right after the event. Early intervention, often through therapy and sometimes medication, can help reduce symptoms and may prevent the condition from developing into long-term post-traumatic stress disorder. It's essential to recognize that everyone's response to trauma is different, and seeking professional help can make a big difference. If you or someone you know is experiencing these symptoms after a traumatic event, talking to a healthcare professional is a vital step toward recovery. Remember, understanding ASD helps us see how trauma impacts the brain and highlights the importance of timely support to promote healing and resilience.